Good afternoon. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tobangar, that is the Los Angeles Basin and South Channel Islands. My name is Todd Hughes, and I'm the director of the California Health Interview Survey. For those of you unfamiliar with CHIS, it's the largest population-based state health survey in the nation. Welcome to today's webinar, Firearm Access, Storage Practices, and Suicidal Risk among Veterans in California, findings from the 2021 California Health Interview Survey. According to the California Department of Public Health, 583 veterans died by suicide in California in 2020, with 3 in 5 of those suicides being the result of firearm injuries. Access to firearms and specific storage practices, such as storing a firearm loaded with ammunition and unlocked, are associated with increased suicide risk. The California Health Interview Survey added a firearms module to the 2021 and 2022 surveys to advance knowledge on gun violence related to firearm ownership, storage practices, and perceptions on gun safety. Supported by the National Collaborative on Gun Violence Research, this series of questions will fill critical data gaps about risk factors for gun suicide and urban gun violence related to understudied and disproportionately impacted subpopulations, such as youth and young adults, veterans, immigrants, and the LGBTQ community. Last fall, we shared an overview of some of the findings from the firearms module in the 2021 CHIS. Today, and over the course of the next year, we will release publications detailing the impact on those populations. This afternoon, we welcome research partners from the Firearm Injury Prevention Initiative at the University of Colorado School of Medicine, who will share findings from a fact sheet released this morning on firearm access, storage practices, and suicidal ideation among California veterans in 2021. This report shines a light on an issue that is often dismissed or overlooked. And we hope that today's discussion serves as a reminder of just how critical the issue of suicide ideation is among this population, and why the implementation of programs that facilitate the secure storage of guns is paramount. Today's webinar presenters are Dr. Emmy Betz and Dr. Joseph Simonetti. Dr. Betz is the director of the Firearm Injury Prevention Institute, Firearm Injury Prevention Initiative, and professor at the University of Colorado School of Medicine. Dr. Simonetti is the director of mentorship and education at the Firearm Injury Prevention Initiative and assistant professor at the University of Colorado School of Medicine. Today, they will examine access to firearms among the veteran community and take a closer look at how those firearms are stored. They will also discuss mental health status, mental health care access, and thoughts of suicide among the population. By sharing this information, our goal is to reconstruct programs that would facilitate the secure storage of guns, with the priority being that we can collectively ensure the safety of those struggling with thoughts of suicide, particularly California veterans. Dr. Betz and Dr. Simonetti will also discuss policy recommendations to help reduce the risk of suicide or other firearm injuries for both veteran and non-veteran populations. If you're interested in today's slides, you can request them from our communications department at healthpolicy@ucla.edu. Now, I'm excited to welcome Dr. Emmy Betz and Dr. Joseph Simonetti.
Thank you so much for having us today. We really appreciate the invitation. It's been wonderful to partner with colleagues at UCLA and in California. Not the best state that starts with a C, we have to say here in Colorado, but we always love getting the chance to work with individuals from other institutions. I'm going to kick things off before turning it over to Joe for the bulk of the presentation. But we wanted to start by just giving a bit of background on our initiative and what we're about. Next slide, please. So the Firearm Injury Prevention Initiative at the University of Colorado, we actually just officially launched this week, although we've been in the works growing for the past few years. We are committed to research, education, and collaboration to prevent firearm injuries and deaths in our homes, so including suicide, domestic violence, and unintentional shootings, as well as deaths and injuries in our communities, be it from community violence, school violence, mass shootings, or police-involved shootings. We hold as core values a recognition of the really common goal of health and security. That is that everyone wants their loved ones, their friends, their colleagues to be safe. We respect diversity in all of its forms and really appreciate input of a wide range of views from those both for or against firearm ownership or all kinds of firearm policies or behaviors, because we believe that it's through engagement of impacted communities and those with lived experience, including those with lived experience in either suicide attempt, suicide survival, suicide loss, as well as military experience. Engagement of those communities is what will ultimately lead us to the development and implementation of effective programs to prevent injuries and deaths. Next slide, please. We have core areas, and we do hope you'll check us out. You can sign up for our newsletter if you're interested in hearing more. So we're committed to doing action-oriented and innovative research that does include policy research, but also understanding program development, intervention development, and dissemination. We have outstanding education and mentoring led by Dr. Simonetti. We really want to educate everyone from the public through to clinicians or law enforcement individuals who might be in a space to work with those at risk. And we're really excited to be doing a lot of work with the military as well as with veteran communities, because again, we are grounded in this space of wanting to understand the perspectives and the needs of those who are affected by firearm injury and death, including firearm suicide prevention. And that's the lens through which we work and the lens through which we've really been thinking about this work in understanding veteran access to firearms in California. So I will now turn it over to Joe Simonetti.
Okay. Thank you, Emmy, for kicking us off. Thank you, Mr. Hughes, for the kind introduction. Just a reminder, everybody, just throw your questions in the Q&A and we'll get to them by the end of the presentation. So this slide represents, I think, really the fundamental reason why we're here today. On the top line is the age-adjusted suicide rate among veterans over the past 20 years in our country, in comparison to the age and sex-adjusted suicide rate among non-veteran U.S. adults over the past 20 years. And there's a clear divergence of those lines. Depending on the study, the suicide risk among our former service members is probably 20 to 30% higher than what it is among those who didn't serve. And while, based on media reporting and all the science that's been coming out over the past couple of decades, that might sound obvious, but that's actually not the case in many other countries, including high-income countries. And the suicide risk among our service members and former service members was actually not substantially different than the civilian population prior to the Iraq and Afghanistan wars in the early 2000s. The other reason that I think it's important to note why we're here today is that according to the most recent VA/DoD suicide prevention report, of all the suicides that occur among our military veterans, about 71% of them are attributable to firearm injuries. And that's in comparison to about half of all suicides among the non-veteran American adult population. So a really significant difference. The California Department of Public Health releases information annually about suicide deaths in California, including the subset of individuals who are identified as military veterans. And as sort of Mr. Hughes alluded to, in 2020, the last year for which we have accurate information, 583 California veterans died by suicide, and 61% of those suicides were attributed to firearm injury. So why is suicide risk and firearm suicide risk and the proportion of suicide attributable to firearm injury higher among American military veterans? Well, suicide is a really complex outcome. It's predicted by myriad factors, intersecting factors that we could spend an entire college course talking about, quite frankly. And certainly veterans, whether combat related or non-combat related, have some unique risk factors for suicide, certainly. And I'm not here to tell you today that firearm access is the sole driver of this difference in suicide risk among the population we're talking about here today. But I will at least try and make the case that it is relevant to the discussion. We know across now dozens and dozens of studies that having access to a firearm is an independent predictor of suicide. And that's independent of other underlying risk factors. And so when you look at populations or households who have access to firearms and those who don't, really when you look at rates of depression, alcohol use, history of suicide attempt or suicidal ideation, those other predictors of suicide outcomes appear fairly similar. As best as we can tell, one of the major differences is really that access to a firearm. And so what do we know so far about access to firearms among military veterans? Well, not much at the state level. Really, the first data about this come from the 2015 National Firearms Survey, which was a nationally representative study of American households as well as American veteran households. And in 2015, we found that whereas 30% of US males identified as firearm owners, 47% of US male veterans identified as firearm owners. And the difference was even, I think, more stark among female veterans, whereas 12% of US females overall said they were firearm owners, double that, 24% of US female veterans identified as firearm owners at that time. So really substantial differences in access to firearms at the personal level. But we know that if you want to inform, a lot of the things that we do for prevention, whether it's policies, clinical interventions, legislation, really a lot of that happens at the state level. And so to think about how you go about approaching a problem like this from a state level, it's really important to understand state level differences in things like firearm access and storage. And certainly there is good reason to think that there are differences. There aren't great national data, quite frankly, about state level differences, but the RAND Corporation has done really fantastic work to estimate what they presume to be the prevalence of household firearm ownership across the 50 US states, as well as the national average. And what you see in these individual gray lines across the screen, for instance, are the estimates of firearm ownership at the state level. So in the early 2000s, you could see 2003, California was estimated at 21% of households had a firearm in them. Some states were as high as almost 70% at that time. So really big differences. And so that's a little bit of why we sort of set about on this study. Just a quick aside, access to a firearm is certainly an important predictor of suicide, but there's other things that matter too. How individuals decide to store their firearms in the house, whether they're loaded with ammunition or unloaded, whether they're secured in a cabinet or not, are really important for understanding suicide risk. And there's a lot of complex reasons for that, but let me boil it down to you very simply with this sort of graphic, which was I adapted from sort of Kathy Barber's work. And the idea is that somebody with suicidal intent, if they have their access to a firearm delayed, whether it's because it's out of the house or because it's stored in a cabinet, it takes longer and it's harder to get to. Two things can really happen there. Either the crisis that they're in resolves and they never go on to attempt suicide, which is obviously what we want. But in certain circumstances, we know that we can't prevent all suicide attempts. If they don't have access to a firearm in that case, and they attempt using another method, every other method available to them has a lower case fatality than a self-inflicted firearm injury. 90% of individuals who harm themselves with a firearm with intent to end their lives will die from that injury, by far and away higher than what you see with any other self-inflicted method of injury. And so our goal with this study was to estimate the prevalence of firearm access among veterans who reside in California, describe their firearm storage practices, and estimate the prevalence of specific mental health risk factors for suicide and the intersection of those risk factors with with firearm access and firearm storage practices. To do this, and I won't elaborate much on this, but we use the data from the 2021 California Health Interview Survey, which I think Mr. Hughes gave a great introduction about. It's a really fantastic resource for studying not just access to firearms and firearm-related factors, but it's a really impressive survey otherwise, I think. It's a state representative survey of Californians. We included for this study those who self-identified as military veterans, and that included 760 survey respondents, which were then weighted to basically represent the state veteran population. There were a bunch of items included in this survey. The key ones really for the study that we're talking about here today are whether or not the respondent lived in a household with at least one functioning firearm, how they stored that firearm, their access to healthcare, and a number of their mental health characteristics. So, bottom line, about 6% of California adults identified as military veterans in this sample. And 38.1% of those veterans in California reside in a household with a firearm. So a really high proportion of individuals with firearm access. Of those who said they lived in a household with a firearm, the average number of firearms owned was 4.3. So quite a few firearms in circulation among this population. And then we found that 1 in 3, or 36% of those California veterans who lived in a household with a firearm said that at least one firearm they had in their house was currently stored without any locking device. And that means stored not in a gun safe or cabinet, not using a lockbox, not using a trigger or cable lock. It was completely unsecured. About 25% of those individuals had a firearm in the home that was currently loaded with ammunition. And about 14% of individuals had at least one gun in their household at the time of the survey that was both unsecured in any way and loaded with ammunition. So when you focus more narrowly on this population of veterans in California who lived in households with firearms, what does the picture of their mental health look like? Now, obviously, there are dozens and dozens and dozens of features that we can use to describe mental health characteristics. We use the ones that we thought were most relevant, and obviously the ones that were included in the survey, which were picked, I think, for good reason. At the time of survey response of the individuals with guns in the house, about 6% had symptoms, mental health symptoms, which were consistent with what we refer to as serious psychological distress. 14% had reported that at some point in their life, they had thought about ending their lives by suicide. And among that 14%, 21% had thought about ending their lives in the past year. So within the year preceding their survey completion. And among those 14% who had at some point in their life had thought about suicidal ideation, about 1 in 4 had actually attempted to end their life. Among these individuals with household firearm access, really significant percentage of people who have thought about or actually attempted to end their lives. 24%, I think, somewhat surprisingly, had received mental health care in an emergency setting in the past year. And at the time of survey completion, 18% reported currently needing some sort of help for a mental health, alcohol, or drug issue. So what's the intersection of firearm storage practices and suicidal ideation? This figure shows two populations. On the left, the individuals who had reported any lifetime suicidal ideation, and on the right, the rest of the population, the folks who said, no, there's no point in my life that I've ever thought about killing myself. What do their gun storage practices look like? Well, in the folks who had historical suicidal ideation, about 18% currently had a gun in their home that was loaded with ammunition and unsecured in any way. It wasn't locked up. And that's in comparison to 13% of the individuals who at no time had thought about ending their lives. Now, there's always a little bit of error around these estimates. We're trying to estimate a statewide prevalence of a practice based on the 700 or so individuals who responded. And so I can't tell you that these differences are statistically different. Statistically, there are not. Regardless, that 18% of individuals with some history of suicidal ideation had a loaded and unsecured firearm in their home, I think is regardless concerning. So in summary, about 38% of California veterans live in a household with at least one firearm. Again, the mean number of firearms in those households is more than 4. How does that compare to other figures that we know? So going back to the data from the 2015 National Firearm Survey, about half of veterans nationally report that they own a firearm. And again, those data are now 8 years old, so we don't know what that would look like today. There's been other good work done also from the California Health Interview Survey, which found that about 16% of California non-veteran adults identify as firearm owners. So that if you think back to the figure I showed you of the estimates of state level firearm prevalence, that 16% is really on the low end nationally, but it's less than half of that of the California veteran population. So again, a really substantial difference in terms of who owns guns within California. We also found that unsecure firearm storage practices are really common, including those with mental health risk factors for suicide. And overall, about 14% of individuals who identified as veterans and gun owners in California had a firearm that was loaded and unsecured. And that's about twice the prevalence of what you see in terms of storage practices among California non-veteran adults. And also, I think, just to put it bluntly, we also identified a really substantial need for mental health services. Nearly 1 in 5 veterans who responded to the survey and said they had firearms in the household also said that they, at that time, needed mental health services. So how do you go about responding to issues like this? I mean, when you're talking about suicide prevention and you're talking about mental health need, I think one of the obvious things that we have to start thinking about is how are our healthcare systems engaging these individuals? And you know, what comes to mind for me as somebody who works with the Veterans Health Administration is their role in all of this. And I think over the past 10 years, they've taken a fairly aggressive stance in terms of firearm suicide prevention by expanding access to mental health services, as well as their screening for suicide risk. They have trained most of their workforce at this point to discuss firearm suicide risk with patients. We're talking about hundreds of thousands of employees. And I think has taken really bold steps and is one of sort of the national leaders in partnering with the firearm community to engage them in suicide prevention, whether that's through supporting firearm retailers to build out storage space for veterans who are in need, such as being done in the Armory Project or the Betz program, or other initiatives along those lines. Unfortunately, you know, the Veterans Health Administration, it's actually a minority of veterans who are actually eligible for their healthcare services. And so the extent to which other healthcare systems can step in and fill the void, I think is a little bit unknown given sort of the fractured state of healthcare, not just in California, but I think nationally. Having said that, healthcare systems, I think, have a clear role whenever you're talking about this intersection between firearm suicide risk and mental health characteristics. Again, that's not to say healthcare systems are sort of the only solution here. There are lots of community partnerships which we've seen expand, you know, I think really substantially over the past 5 years. We say sort of gunshot projects as sort of a catch-all term. You know, some of these have been going on for clearly more than 10 years now, but these continue to expand. The scope of the work happening within what you might call a gunshot project is starting to expand. And I think we found, certainly here in Colorado, and this is certainly the case in other states, that these partnerships are just truly invaluable, not just because I think that folks working in the retail community carry with them a different level of credibility. They have a different level of knowledge in terms of firearm access and what it really means to intervene with individuals who need help. There's programs like the Overwatch Project, which are coming up with really cool novel messaging and peer interventions to support individuals who identify as veterans or law enforcement in terms of firearm suicide prevention. We've seen great work from national messaging campaigns. A number of states now, including Colorado, Washington, Maryland, have developed firearm storage maps so that individuals, when they do have mental health issues and access to firearms, can more easily identify places in which they can put their guns while they're in recovery and do so on a voluntary basis. And, you know, the big thing really is we know some folks just aren't willing to remove their firearms from the home, even temporarily, while they're at risk. So what do we do to promote more secure storage practices for the individuals, particularly those we identified in this study, who just aren't using secure storage at all? And so finding ways to identify what kind of preferences individuals have for storage device options, get those devices to them in a way that there's not a lot of obstacles, particularly cost-related obstacles, and also, you know, reinforcing that with messaging and training and education about not just the relevance of doing this in terms of preventing one's own injury, the importance of doing that to prevent other things like injury among kids in the house, prevention of theft, and all sort of the downstream effects that happen after firearms are stolen from the house. With that, I again want to thank everybody for the opportunity to be here to present today and for the opportunity to collaborate on this really fantastic survey data and work. I'll pause and I'll stop for any questions.
Thank you so much, Dr. Simonetti and Dr. Betz. My name is Tiffany Lopes. I'm the Director of Communications here at the UCLA Center for Health Policy Research. I'm going to be moderating the Q&A and asking our two researchers some questions. We have just one question so far. So if you have questions, please drop them in the Q&A or in the chat. So one question is, do we know what percentage, if any, of the veterans with loaded and unsecured firearms are law enforcement officers?
We don't currently. That's a really fantastic question. We know that law enforcement is a fairly common profession for somebody to pursue after their military service. And I do know that the California Health Interview Survey does ask a lot of questions about employment status, including whether somebody currently works in law enforcement. So that question is theoretically answerable, but actually we didn't approach it, but that's a great point.
Thank you. Let's see. Oh, one question coming in right now. Do the data differentiate between veterans from different eras? Can these data help target interventions towards different groups of veterans?
It's a very cool question. Let me just advance the slides real quick here and see if I included this. I did not. So again, this survey is just like a really tremendous source of data. It identifies a bunch of personal, household, community characteristics, which you could actually use to develop sort of more targeted information or more relevant information to sort of subpopulations or veteran subpopulations. I did not include a lot of demographic and military service characteristics information in this presentation because it was sort of just a broad overview, but we do have service era, and we do know whether individuals served in Enduring Freedom, whether they are World War II veterans or Korean War veterans. I am not going to go through those percentages right now because I'm going to get them wrong if I go off the top of my head. What I do know is that those percentages, that distribution, basically mirrored what you see in the national veteran population in terms of who served in what service era. But to sort of, I think the better point is that there is a tremendous amount of data available. And so I think work among subpopulations of veterans in California would be really important. Great question.
And then there's a similar question.
Can I just add?
Of course.
I just put the link in the chat again to the full publication that is now available online. Does have the specific statistics that Joe was just mentioning.
Oh yeah,
great.
Thank you.
Thank you. And then there was an additional question about additional breakdown of demographics for the vet data, so race, ethnicity, LGBTQ plus identity. And though that is not, we've got some of that information in the fact sheet, but additional information can be found if you go to ask.chiz.ucla.edu. You can sort by a wide range of sociodemographic factors.
Yep, here's a limited number. If you look at the publication that Emmy put in the chat box, you'll see even more. One of the things that becomes challenging is when you're dealing with a sample size of 760, which is fantastic, and you're trying to weight them to a larger population. Once you get into smaller and smaller and smaller groups of folks, it becomes really hard to derive statistically stable estimates. So in other words, putting a percentage out there and saying I have any confidence that that's the correct number. But that being said, there's lots of other data we have available to us to describe this population. This is just a brief snapshot.
And I believe that the UCLA team that's leading this work, funded through the National Collaborative on Gun Violence Research, is doing a separate analysis focused on LGBTQ populations, and they may be looking at veteran status within that. That was part of the reason we actually didn't dig into that in this publication, and I don't remember off the top of my head the time frame for when that report will come out.
Thank you for bringing that up. Yes, so as part of the National Collaborative on Gun Violence Research Grant, we are studying several populations, veterans being one of them. So that's what we released today. And then over the course of the next 8 or so months, we're going to be releasing publications on the immigrant population, as well as LGBTQ community, and I believe youth and young adults is the next one that's coming up as well. So definitely, if you're not already subscribed to our newsletter, if you email us at healthpolicy@ucla.edu, we will add you to our list and you will get those publications as soon as they are out. Couple more questions. Can you speak more about the community partnership aspect of this initiative? What are best practices for sharing this data with concerned community and gun industry members?
Emmy, you want to take that?
Sure. So this particular initiative didn't include community partnership per se. This was really an analysis of large survey data, because that's really important for us to understand what's going on. Both Joe and I, as well as many others in California and across the country, are engaged in various kinds of community engagement partnerships with gun shops, retailers, veteran service organizations, and so forth. Because I do think it's incredibly important that we get this kind of information out to the community. In particular, because I think we've seen in study over study that many firearm owners don't know about the risk of suicide death when there's firearm access, and they don't know some of the background that Joe talked about why it is that firearm access in a time of risk in a time of suicide risk can significantly increase the risk of death. In terms of best practices, I mean, I think in my experience, a few things. I think being open and transparent about where data come from and being very careful not to sort of cherry pick statistics or try to kind of massage it into your message. I think there's understandably a lot of mistrust, I think, when it comes to anything firearm related, and a lot of yelling at each other. So it's very important to be clear about what you can and can't say from the data. And then I think approaching individuals with we want to give you this data because we think it's important and it might inform the work you might want to be doing with your own community. And in my experience, for example, gun shop owners have been very interested to hear about statistics in terms of suicide statistics and so forth, and then hear also what they can do with it so that the message is not doom and gloom, here's sad numbers, but actually how do we then reframe that? I'll put a link in the chat to some of the examples of messaging and programs that are out there around this in case they might inspire you. Yeah. Joe, do you have anything to add? Sorry, right as I say that, I have one other thought, and Joe, you might elaborate on this from within the VA. I think when it's a one-on-one situation, it's in a counseling situation, for example, always very clear, we're not talking about stigmatizing ownership. It's not about you're a bad person because you own a gun, none of that. It's purely about we want to prevent injury or death. So let's talk about safety. And I think the VA has been very careful with this, with its messaging in that sense.
I don't have much to add. It's great points.
Thank you. In Riverside County, we have a suicide prevention coalition. In our intervention subcommittee, we have tried approaching firearm shops to help us in the efforts of prevention, but have not been successful. Do you have any suggestions or ideas to increase the willingness to be part of suicide prevention?
I'll maybe just jump on that one too. Joe has a lot of experience and can add as well. But so not every location will, maybe immediately be interested, and it might have to do with how busy they are and their capacity to take on extra projects and things. But I think for those of us in the prevention space, it's important we kind of double check how we're framing things, what we're asking for, what we're suggesting they do. And I would definitely urge things always be framed in a voluntary way. Hey, we have some brochures if you want to give these out, or hey, this is something you could do if you want to make it clear that it's not like a state mandated, you have to do this in this way kind of a thing. Because it really is about building up relationships and trust. If you can find someone on your team who's also a member of the firearms community somehow, who is a firearm owner or a veteran or otherwise has a little more of that immediate credibility, that can also be a really helpful way, I think, to start to build those relationships. Joe, anything you would add on that?
So I also think that just sort of when you think about sort of engaging involved or interested or relevant parties in whether it's research or public practice, it's important not just to go and say, we'd like you to do this, but also to sort of in an authentic way say, is there something you can contribute to this? That, I said this and we could talk for hours about this. There's just tremendous expertise in the firearm retail community and the firearm owning community that I'll never have And so if I'm able to approach them with an open mindset that they have something to offer as equally as I might have to offer them, I think that leads to a probably more productive conversation. And then just reiterate exactly what Emmy said, which is everybody's not going to jump onto this. I do think that there's lots of interest in this. Interest is growing, and I think 10 years from now, we'll see way more retail and shooting spaces on board than we do today. But there's going to be early adopters, there's going to be middle and late adopters, just like there is with anything else. And understanding that maybe even most sites aren't going to be willing to participate is just, I think that's a good expectation to go in with.
Along those lines, are there intervention efforts at the healthcare system or community level that seem promising but need more research to determine if they are effective?
Yeah, I think everything needs more research to figure out how effective they actually are and among whom they might not be. You know, there are lots of healthcare system initiatives that are happening right now. I mean, I work within the VA, and so I'm a little bit biased towards the VA's efforts, but they have, I think, the better part of 8 or 9 years now, sort of been out front in terms of training an entire national workforce to understand, identify, assess, to mitigate firearm suicide risk. And we've worked with thousands upon thousands of clinicians to try and teach them not only the nuts and bolts of like, how do you ask about a gun and what recommendations do you make, but also like cultural factors. So why is it that the individual you're working with might not be open to this conversation, or if they are, why might they be resistant to doing something different with their gun? As Emmy talked about earlier, managing bias is sort of a big part of this, and we know that's important in all of clinical care. But you know, we have folks who have biases across the entire spectrum. They're extremely pro-firearm. They can be very anti-firearm. Both of those things can be very harmful, I think, to an objective patient-centered clinical discussion. And so we do a lot of training in terms of like, how is it that you have a really patient-centered conversation while leaving your own baggage at the door? That's just the clinical stuff, and that's really just specific to the VA. There's lots of stuff happening, I think, elsewhere. I think particularly in the community settings, there are a lot of community partnerships now which have, you know, popped up, and they've been around for a long time, but they've really increased in number, I think, over the past 10 years. And whether that they might have a pediatric focus, or maybe they do have a veteran focus. There are lots of events happening out there around increasing education about secure firearm storage and responsible firearm ownership, about identifying mental health risk factors for suicide or risk factors for unintentional injury and doing something about it. When you think about the scope of the problem nationally, the amount of attention that's paid to firearm injury nationally, you know, the amount of studies that have been published, particularly high quality studies, is very, very low. Fortunately, you know, as there's been more attention to this and funding that's come in to support this work, we're seeing a lot more being done. And so I think the answer to my question will look very different maybe in 5 years from now. But so far, we need more data.
What are the main mechanisms of firearm-related deaths, accidental suicide, homicide among veterans?
I'll jump in with a partial answer, and then Joe, you may have more information. So we couldn't answer that in this survey because these are people who are living. Nationally, across all populations, we know that the majority of firearm deaths are suicide. Depending on the population, it's somewhere, and depending on the state, it's at 50 to 60%. Here in Colorado, it's 76% of gun deaths are suicides. Then the next biggest proportion, somewhere in the 20 to 35 range, is homicide. Accidents, mass shootings account for maybe 1 to 2, at most 2% of total firearm deaths. Flipping in a different way, we know that among veterans who die by suicide, I think it's something like 70% are by firearm, so it's higher than in the general population. I don't actually know of specific statistics looking at that proportion of gun deaths total among veterans and what proportion are suicide versus other things, but I would extrapolate from what we know about other populations that the majority of veteran firearm deaths are also suicide. Joe, do you have other statistics?
Yeah, there's ongoing work to answer that question, I think, definitively. I am trying to actually briefly search the internet and my brain to see whether or not there's like good data on this. And I actually don't think that there is. If anybody wants to ping me via that email later, I'll let you know if I find anything else.
Thank you. Those are all the questions we have for today. I just want to thank you all for attending this month's webinar. And a special thank you to Dr. Simonetti and Dr. Betz for sharing their knowledge with us today. We will be posting the recording of this webinar online with closed captions in a few weeks. So please visit healthpolicy.ucla.edu/seminars. If you'd like a copy of today's presentation, you can email us at healthpolicy@ucla.edu. I will be posting the link to our YouTube and email address in the chat as well. And also just want to draw your attention to the chat one last time because Dr. Betz did post some great resources there. So thank you so much to everyone and have a wonderful rest of the day.
Thank you.